Greetings, friends. Today we are discussing the teamwork approach to defeat this COVID-19 pandemic. I will start by emphasizing that our primary strategy is not dependent on sophisticated equipment from somewhere or a huge fund from somewhere, but on preventive measures based on our frantic efforts as individuals to follow the national health guidelines to prevent all possible forms of transmission. Prevention is better than cure. Today we will discuss different levels of prevention. For example, national level, community level, person-to-person level, clinic, surgery, and hospital level. That is transmission between doctor and patient or next patient, and transmission from health workers' clothing to family, and home level prevention and religious level measures in summary. But now I assume that you know that this coronavirus can be spread from person to person through droplets when an infected person speaks, coughs, or sneezes. These droplets are too heavy to travel far in the air. They travel for approximately 1 meter and circle on surfaces. This is the reason why social distancing helps to minimize risk of person-to-person transmission. The virus may remain on contaminated surfaces long enough for contact transmission to whoever touches those surfaces. Since our hands touch contaminated surfaces unaware, it is recommended that you clean your hands frequently with an alcohol-based sanitizer or soap and running water. It's good to keep cleaning the frequently touched surfaces where the virus may hide. For example, door handles. Avoid touching your face so that you prevent the virus from entering through your eyes, nose, and mouth. Wearing a mask reduces chances of you catching the virus or transmitting it to other people. Assume everyone is infected, because the ones who have no symptoms can spread the virus if infected. At national level, let's all comply and adhere to the national guidelines and strategies implemented by the Ministry of Health. For example, during national lockdown to prevent rampant spread of the virus, let's stay at home and practice social distancing and avoid as much as possible crowding at supermarket queues and overloaded transport systems. At community level, let's spread the correct awareness information in all languages on social media, only from reliable sources, avoiding false unverified information that causes unnecessary panic and fear. Follow all hygienic guidelines and social distancing and avoid unnecessary travel. This is not a time to be over-visiting our parents who are more vulnerable. Let's minimize crowds at funerals and as much as possible postpone weddings or reduce numbers to a few spaces or witnesses. At clinic, surgery or hospital level, our trained healthcare workers must strictly adhere to national guidelines on personal protective equipment, PPE, for COVID-19 to avoid patient-to-doctor and staff or vice versa transmission, and to reduce the risk of health workers carrying infections to their families. PPE includes a gown, a mask, respirator, goggles or face screens, gloves and overshoes. Depending on clinical role or situation, waste management and linen should be exactly according to the national guidelines. Reusing gowns risks cross-contamination depending on clinical role. After the patient, remove the PPE in correct order. This way, gloves, hand hygiene, face shield and goggles, gown, mask, hand hygiene. Then disinfect every contact surface and floor. Ensure adequate ventilation in all treatment areas. Always decongest the waiting room. The fewer and more spaced the number of patients in the waiting room, the better. As much as possible, let each patient wear a mask as they wait. Do infrared thermometer temperature screens to screen patients with high fever. It is advisable to remove all books and magazines at waiting area and constantly clean surfaces. Hand sanitizers must be available at reception entrance. When going home after a work day, the healthcare worker should take off shoes, remove and wash clothing, and immediately shower before even joining family and little ones. In case of suspected exposure, the healthcare worker should self-quarantine for 14 days. During this crucial phase, patients should understand if some specialists, for example dentists and surgeons and ophthalmologists, restrict their ops to emergency cases as they fully adapt their PPE standards. This is because they work in high-risk areas in the faith. At equipment level, great efforts are made nationally to prevent even for worst cases that should be prevented by these measures. At home level, stay at home, avoid visiting and visitors as much as possible. Wash your hands, door handles, and potentially contaminated surfaces. At fitness level, eat healthy foods, exercise, and avoid stressful events and information. At corporate level, defer all non-urgent staff meetings, apply fastidious hygiene and protective measures, and wear a mask where appropriate. At religious level, be balanced in your faith and avoid unnecessary extremism. By prayer and faith, put everything in God's hands and wash your hands and follow medical advice as the Bible teaches us to obey our rulers. Let's keep the fire burning and pray like never before. I believe our prayers can turn things around. Online services must continue as we use technology and social media to win souls and minister to the sick and needy through our mobile phones. God will help us with divinely inspired strategies of taking care of the flock, bearing in mind that this actually happened in Isaiah 26 verse 20. And in the days of great men like Luther, Wesley, William Seymour, and William Branham. God bless you all. United we stand, but divided we may fall. Visit our YouTube page, Spoken Word Fellowship Bulawayo, and Facebook page, Spoken Word Fellowship Married Church and Courts.